Yeah, so the serum tryptase requirement that was part of Consensus 1 criteria for the diagnosis of Mast Cell Activation Syndrome is widely criticized for this reason. The criteria was originally put out in 2012 and most recently, I think, updated in 2017 to expand on the testing that is required to meet this criteria because this tryptase requirement is so hard to meet just realistically for a lot of people who have MCAS symptoms. And one of the reasons is precisely this, that when you have a flare, especially if you're going to the ER, those ER docs are more preoccupied with saving your life than running a tryptase. And a lot of them they don't really care about the long-term diagnosis. And this is not to sound bad, like ER doctors are there to save your life. They're not there to manage you beyond saving your life in this moment. And the other issue with MCAS and tryptase is that usually people with MCAS have a constellation of symptoms that are constantly flaring and remitting all the time. And one of the critiques of this tryptase-focused testing is that there are times where a patient does not really go to their true baseline because they have constant symptoms going on. Their tryptase is always going to be a little bit elevated, so that blurs the line of what is actually baseline and what is actually a flare, and it makes it really difficult for people to get diagnosis this way. And this is why the most recent criteria in 2017 was revised to include other testing so that we can catch more of these cases where the tryptase really isn't a realistic marker. And these can include 24-hour urine collections like N-methylhistamine, prostaglandins, and other histamine or leukotriene breakdown products. If you'd like to know more about the diagnosis of MCAS and how it's evolved and changed in the past decade, I do have an online course that's available. The diagnosis portion is completely free because I think this is really important information to get out to doctors who are seeing patients with MCAS. There's been a lot of development in the past decade. The updates of both criteria that are used in 2017 and in 2020, they have changed a lot. And as MCAS is getting more and more frequent, the management has also changed too. So I also have sections on the pharmacologic management of MCAS and natural agents and dietary interventions. Cheers!